ethical responsibilities in healthcare. To begin, let's define ethics. Ethics is the study of conduct and character in a professional context. A code of ethics serves as a guide, outlining the expectations and standards of a given profession. For nurses, this code is crucial in navigating the complex landscape of healthcare. Ethical theories. Now, let's delve into ethical theories. These theories examine principles, ideas, systems, and philosophies that influence judgments about what is right and wrong, as well as what is good and bad. 4 common ethical theories are utilitarianism, deontology, consensus in bioethics, and the ethics of care. Each theory provides a unique perspective on ethical decision-making. Ethical principles. Ethical principles are standards of what is considered right or wrong in relation to important social values and norms. These principles apply to individuals, groups of individuals, and societies at large. It's essential for healthcare professionals, including nurses, to understand and apply these principles in their daily practice. Values and morals. Let's distinguish between values and morals. Values are personal beliefs about ideas that shape standards influencing behavior. Morals, on the other hand, are personal values and beliefs about behavior and decision-making. Both values and morals play a significant role in ethical considerations within the healthcare profession. Ethical decision-making in nursing. Now, let's focus on ethical decision-making in nursing. Bioethics, a critical component of this process, refers to the application of ethics to health and life. This includes addressing dilemmas such as stem cell research, organ transplantation, gender reassignment, and reproductive technologies like in vitro fertilization and surrogate parenting. Basic principles of ethics in healthcare. These principles serve as a compass, ensuring that we navigate the complex landscape of healthcare with integrity, empathy, and a commitment to our clients' well-being. 1. Advocacy. Our first principle is advocacy. In healthcare, advocacy involves the unwavering support for our clients' health, wellness, safety, and personal rights, including the right to privacy. As healthcare professionals, it is our duty to champion the best interests of those under our care, promoting their rights to receive respectful and compassionate treatment. 2. Responsibility. Next, we have responsibility. This principle underscores the importance of being willing to respect our obligations and follow through on promises. Whether it's fulfilling our duties as healthcare providers or meeting commitments to our clients, taking responsibility is key to maintaining trust and upholding the standards of care. 3. Accountability. Accountability is our third principle. It involves the ability to answer for our own actions. As healthcare professionals, we must be transparent and accept responsibility for the outcomes of our decisions and interventions. Accountability fosters a culture of continuous improvement and ensures that we learn from our experiences to enhance the quality of care we provide. 4. Confidentiality. Last but not least, confidentiality is a critical principle in healthcare ethics. It emphasizes the protection of privacy without compromising access to high-quality care. Respecting and safeguarding the confidentiality of our clients build trust and create an environment where individuals feel secure in sharing sensitive information necessary for their care. Ethical principles for client care. Before we dive into the specifics, let's understand that ethical considerations play a crucial role in the healthcare profession. The principles we discuss today serve as a compass, guiding healthcare professionals in providing optimal care while respecting the autonomy and well-being of their clients. 1. Autonomy. Our first ethical principle is autonomy. Autonomy grants individuals the right to make their own personal decisions, even when those decisions may not align with what others perceive as being in their best interest. It emphasizes the importance of respecting a person's right to self-determination. 2. Beneficence. Beneficence is this principle that underscores the importance of actions that promote good for others without any self-interest. In the context of client care, healthcare professionals are encouraged to act in the best interest of their clients, ensuring their well-being and promoting positive outcomes. 3. Fidelity. Fidelity, our third principle, revolves around the fulfillment of promises. Healthcare professionals are bound by a commitment to uphold the promises they make to their clients, fostering trust and maintaining the integrity of the patient-provider relationship. 4. Justice. Justice in client care revolves around fairness in care delivery and the equitable use of resources. It ensures that all individuals have equal access to healthcare services and that resources are distributed fairly, promoting a just and impartial healthcare system. 5. Non-maleficence. Non-maleficence, our fifth principle, reflects a commitment to do no harm. Healthcare professionals must prioritize avoiding harm to their clients, and their actions should always aim to benefit the client without causing unnecessary harm or suffering. 6. Veracity. Veracity entails a commitment to telling the truth. Open and honest communication is crucial in client care, fostering trust between healthcare professionals and their clients. Ethical dilemmas. Let's start by understanding what ethical dilemmas are. Ethical dilemmas are problems that arise when there is more than one choice available, and these choices stem from the differing values and beliefs of the decision makers involved. In the realm of healthcare, these dilemmas are not uncommon, and nurses, as frontline caregivers, are tasked with the responsibility of applying ethical theory to navigate these complex situations. Identifying an ethical dilemma. How do we recognize when we're faced with an ethical dilemma? There are a few key indicators. 1. Insufficiency of scientific data. When a review of scientific data is insufficient to provide a clear solution, it flags the issue as an ethical dilemma. In these instances, we must rely on our ethical reasoning to guide our decisions. 2. Conflict between moral imperatives. Ethical dilemmas often involve a clash between two moral imperatives. This means that no matter which path we choose, there will be ethical consequences. It's in these moments that our commitment to ethical principles is truly put to the test. 3. Profound impact on the situation and the client. An ethical dilemma is characterized by the potential for a profound effect on both the situation at hand and the well-being of the client. The decisions we make in these situations can have far-reaching consequences, making the ethical dimension even more critical. Now let's explore how nurses can apply ethical theory and decision-making to effectively address these dilemmas. Ethical theories provide frameworks for analyzing and resolving ethical issues. Common ethical theories include deontology, utilitarianism, and virtue ethics. 1. Deontology. This theory focuses on the inherent nature of actions. It emphasizes the importance of following moral rules and duties irrespective of the consequences. When applying deontology, nurses must consider their ethical obligations and act in accordance with established principles. 2. Utilitarianism. Utilitarianism, on the other hand, prioritizes the greatest overall good. In healthcare, this means making decisions that maximize benefits and minimize harm for the greatest number of people. Nurses must weigh the potential outcomes and choose the course of action that leads to the greatest net benefit. 3. Virtue ethics. Virtue ethics centers on the development of good character traits. In ethical dilemmas, nurses practicing virtue ethics would consider what a virtuous person would do in the given situation. This involves cultivating virtues such as compassion, integrity, and empathy. Ethical dilemmas are an inherent part of healthcare, and as nurses, we must be equipped with the tools to navigate these challenges. By understanding the indicators of ethical dilemmas and applying ethical theories to decision-making, we can ensure that our actions align with the principles that underpin our profession, ethical decision-making. Ethical decision-making is a nuanced process that demands careful consideration of various factors. It is crucial in healthcare, where professionals often face dilemmas that require a thoughtful and principled approach. Steps in ethical decision-making. 1. Identify the ethical dilemma. Begin by recognizing whether the issue at hand is indeed an ethical dilemma. Not all challenges are ethical in nature, so it's essential to differentiate between ordinary problems and those requiring ethical consideration. 2. Gather relevant information to make informed decisions. Gather as much relevant information as possible about the ethical dilemma. This step ensures that your choices are based on a comprehensive understanding of this situation. 3. Reflect on personal values. Reflect on your own values as they pertain to the dilemma. Understanding your personal ethical framework is essential in navigating the decision-making process. 4. State the ethical dilemma. Clearly articulate the ethical dilemma, including all surrounding issues and the individuals involved. This step provides a foundation for addressing the problem systematically. 5. List and analyze options. Generate a list of all possible options for resolving the ethical dilemma. Analyze each option thoroughly, considering the implications of each choice. 6. Select the ethical option. Choose the option that aligns with ethical principles, your personal values, and the values of the profession. Justify your selection by demonstrating its harmony with relevant variables. 7. Apply and evaluate. Apply the chosen decision to the ethical dilemma and evaluate the outcomes. This step is crucial in understanding the real-world impact of your choice and refining your approach for future decisions. The role of ethics committees. Ethics committees play a vital role in addressing unusual or complex ethical issues in healthcare. These committees provide guidance and support to professionals facing challenging decisions. Examples of ethical guidelines for nurses include the American Nurses Association's Code of Ethics for Nurses with Interpretive Statements, 2015, and the International Council of Nurses, the ICN Code of Ethics for Nurses. These guidelines serve as valuable resources in navigating ethical challenges in healthcare. In conclusion, ethical decision-making in healthcare requires a systematic and thoughtful approach. By following these steps and considering established ethical guidelines, healthcare professionals can navigate complex dilemmas while upholding the values of their profession. Thank you for your attention, and I encourage you to apply these principles in your practice for ethical and compassionate care. Strategies for navigating ethical decision-making in these challenging situations. 1. Communication skills. Effective communication is key. Ensure clarity in conveying information and actively listen to the concerns of clients and their families. 2. Advocacy. Be an advocate for your clients and colleagues. Uphold ethical standards and ensure that decisions prioritize the well-being of those under your care. 3. Ethical frameworks. Familiarize yourself with ethical frameworks and principles that guide healthcare decision-making, such as autonomy, beneficence, and justice. 4. Collaboration. Collaborate with interdisciplinary teams to make well-informed decisions that consider various perspectives and values. Nursing's roles in ethical decision-making are multifaceted, requiring a delicate balance between advocating for clients and making decisions that positively impact healthcare delivery. As healthcare professionals, it is our duty to approach these situations with empathy, ethical awareness, and a commitment to providing the highest standard of care. Thank you for listening to my audio notes on nursing. I hope you found them informative and helpful. If you did, please consider subscribing to my channel for more audio notes on a variety of nursing topics.